Bismillahirrahmanirrahim. Dear students, Assalamu alaikum. Today we will continue our second lecture of ARBs, angiotensin receptor blockers. Last time we had discussed that ARBs, angiotensin receptor blockers, that losartan, valsartan, candesartan, how these drugs will act and how these drugs will produce various beneficial effects in the management of hypertension, in the management of myocardial infarction, in the management of congestive cardiac failure. So today we will discuss all these mechanisms, specifically how these drugs will act. Last time we had discussed that these drugs, losartan, valsartan, candesartan, will act on will act to reduce preload, will act to reduce afterload, and will also reduce the force of contraction of heart. We had discussed all these mechanisms with an example of donkey having load on its back, that preload. For example, we had considered this heart is a donkey, and if we put load on the back of that donkey, these will be preload. So these will be preload on that donkey. Donkey was the heart was considered as donkey. So last time we had discussed that if we reduce the preload, the load on the back of that donkey, if we decrease the preload, the blood going towards heart, if we reduce that, it will be a help with that heart. For example, that heart is a sick heart. That donkey is a sick donkey. The one leg of that donkey is damaged one. The one part, a part of myocardium of that heart is damaged one. So we will give rest to that heart instead of force on that heart to work more and more. We will give rest to that heart. So if we push less blood towards that heart, it will be a help to that heart. So we will reduce the flow of blood to that heart. We will reduce the load on that heart. We will reduce that load. That load will be reduced. So we already discussed that we also reduce the resistance in that arteries, the heart pushing blood to that artery. If we reduce the resistance in that artery, it will also be a help. If we open that artery, if we relax that artery, if we extend the area of that artery, so it will be, the heart can easily push the blood, so heart will have less work performed, so it will be a help to this sick heart. If we reduce that resistance, if we reduce, we had already discussed in previous lecture, that if we reduce the resistance, so it will be a help with that sick donkey. We had already discussed that if we reduce the number of cycles, contraction cycles, from point A to point B, number of cycles, if we reduce the number of cycles, if you tell the donkey to take the blood, to take the load from point A to point B less times. Now, for example, if this donkey is performing its function in a minute, for example 100 times, if we tell that donkey to perform your work instead of 100 times to 70 times to 60 times, it will be a help with that donkey, it will be a help with that heart. If we reduce the contractility of that heart, it will be a help to that heart. So we had already discussed all these in previous lectures. Now today we will discuss how these functions performed mechanistically, what mechanisms are involved behind these activities. So the mechanism involved, how the losartan will act, how the losartan will reduce the blood flow towards heart, how the losartan will cause his relaxation at the arteries, how the losartan will reduce the resistance in that artery, how the losartan will reduce the contraction. So we will discuss it. Number one, the first point, when losartan act, what will happen? Losartan will causes, normally when norepinephrine is released, it will act on beta 1 receptor of juxtaglomerulus apparatus. When norepinephrine, a stress condition, normally we will have two systems cholinergic system and adrenergic system. Both will act simultaneously. Sometimes one will be dominant, sometimes the other will be dominant. When norepinephrine means norepinephrine will be released each and every time, sometimes in small quantity, sometimes in large quantity. What will happen with these norepinephrine? The norepinephrine will act on beta 1 receptor of juxtaglomerulus apparatus. It will cause stimulation of these beta 1 receptors. It will cause stimulation of these beta 1 receptors, which will cause synthesis and release of renin. The renin will act, angiotensinogen will be converted into angiotensin 1. The angiotensin will be converted into angiotensin 2. Renin will act on angiotensinogen, converted into angiotensin 1. Angiotensin 1 will be converted into angiotensin 2 by the action of ACE. The angiotensin 2 will cause various actions. The angiotensin 2 will act on vein side. There are receptors of angiotensin 2 on vein side. When angiotensin 2 causes stimulation of these angiotensin 2 receptors, so there will be constriction in these veins. When there is constriction, more and more blood will be pushed towards heart, more and more will be cardiac output, more and more will be contractility. Again, when this angiotensin 2 will act on artery side, the receptors on arteries, what will happen? The receptors on artery, when stimulated by angiotensin 2, it will also causes constriction in arteries. So when there is constriction, the resistance will be increased. When the resistance is increased, the diastolic blood pressure will be increased. When the resistance in these arteries increased, when these arteries there is resistance, so there will be the pressure will be increased, the diastolic blood pressure will be increased. So from the constriction of veins, the systolic cardiac output will be increased. When there is constriction in these veins, more and more blood will be pushed towards heart with pressure, and the blood will be pumped out with pressure in that arteries. So the systolic blood pressure will rise. And when there is constriction in the artery side, so there will be increased diastolic blood pressure, because the total peripheral resistance will be increased. The resistance towards heart, pumping of heart will be increased. So diastolic blood pressure will rise. Again, when this angiotensin 2 is released, it will act on postsynaptic nerve terminal, and there will be angiotensin 2 receptor and causes release more and more norepinephrine. This norepinephrine will again act on beta 1 receptors and causes stimulation of the release of angiotensin 2, and also this norepinephrine will act on beta 1 receptor of heart. When beta 1 receptor of heart is stimulated by the release of norepinephrine, this angiotensin 2 also stimulated postsynaptic. The angiotensin 2 receptor on postsynaptic nerve terminal causes release of more and more norepinephrine. Norepinephrine will act on beta 1 receptor of heart, causes increased contraction of heart. So the number of cycles will also be increased. This angiotensin 2 electron zona glomerulosa and causes the release of aldosterone. Aldosterone will be increased. Aldosterone will act on collecting tubular cells and causes more and more sodium channels towards terminal. The synthesis of sodium channels will be increased. We had already discussed this mechanism in our previous lectures. So the sodium channels will be more and more, the changer will be more and more, and more and more sodium will be reabsorbed, and more potassium will be released, so salt retention will also be there. All of these mechanisms will causes increased blood pressure. For example, when there is constriction in vein sides, the cardiac output will be increased, systolic blood pressure will rise. When there is constriction on artery side, the constriction will be more and more at artery side. The total peripheral resistance will be increased. When total peripheral resistance is increased, what will happen? The diastolic blood pressure will rise. When the number of cycles is increased by the stimulation of beta 1 receptor by alternate mechanism, that is the stimulation of angiotensin 2 receptors on postsynaptic nerve terminal, excessive release of norepinephrine. Norepinephrine will act on beta 1 receptor. Norepinephrine will also act on alpha 1 receptor at this side. Norepinephrine will also act on alpha 1 receptor at artery side. A number of ways. Constriction will be there again, constriction will be there again, systolic blood pressure will rise, diastolic blood pressure will rise, contraction of heart will be stimulated by stimulation of beta 1 receptor, so cardiac output will be again increased. So when cardiac output is increased, the blood pressure will rise and the load on the heart will be increased, which is really unnecessary for that heart, which is sick one, which is troubleful for that heart. So this angiotensin 2 also causes increased release of aldosterone, which will act on aldosterone receptor on collecting tubular cells, causes more and more salt and water retention. So again, the blood pressure will be increased. When salt and water retention is increased, the blood pressure will rise again. So when blood pressure is increased, the heart will means heart is performing more and more function. And suppose this heart is sick one, for example, congestive cardiac failure heart. So we will have to give rest to that heart instead of performing much and much duty on that heart. So how we can give rest? We will give losartan, valsartan, candesartan. What will happen? Losartan will cause is inhibition of angiotensin 2 receptors. The receptors on veins will be inhibited. The receptors on vein will be inhibited by losartan. When losartan inhibit the receptors on veins, the constriction will be relaxed, relaxation will be there, less blood will flow towards heart, less will be cardiac output. The heart will have less work to perform. So this will be a help to this sick one heart, this donkey, which one leg is broken one. So we can give help to that heart by inhibiting this angiotensin 2 receptor, which will be inhibited by losartan. We can also inhibit this angiotensin 2 by giving losartan. So the angiotensin 2 receptors at artery side will be inhibited. So the constriction will be relaxed at arteries. So the hindrance will be relaxed. So this slope will be decreased one, so easily the heart will perform its function. The donkey can go from one side to other side easily, so it will be a help to that heart. It will, the blood pressure will also be fall. So again, if we inhibit the angiotensin 2 receptor, these receptors will be inhibited. Further excessive release of norepinephrine will be inhibited. Norepinephrine can't work on this beta 1 receptor. Norepinephrine can't work on this beta 1 receptor. There will be no overstimulation of alpha 1 receptors at vein side. There will be no overstimulation of alpha 1 receptors on artery side. So we can treat blood pressure by number of mechanism. We can help this heart by number of mechanism by giving losartan. Losartan will also inhibit angiotensin 2 receptors at zona glomerulosa, which will be inhibited by losartan. When losartan inhibit these receptors, so what will happen? Aldosterone will be decreased. When aldosterone is decreased, overstimulation of aldosterone at collecting tubular cells will be inhibited. When the overstimulation of aldosterone is inhibited, more and more salt and water retention will be inhibited. So the blood volume can't be increased, blood volume will be decreased. So we can again help this heart by reducing the blood volume. Any question regards these mechanisms, any question regards ARBs, angiotensin receptor blockers, or the drugs like losartan, valsartan, you may ask in the comment sections. Hope this will help you. Okay, Allah Hafiz.